So before I get too much further, I'd just like to acknowledge that the University of Alberta is primarily located on traditional territory, lands that are now known as part of Treaties 6, 7, and 8. The University of Alberta respects the sovereignty, lands, histories, languages, knowledge systems, and cultures of First Nations, Métis, and Inuit nations. So just a little bit about the Faculty of Medicine and Dentistry. Some of you may or may not recognize this building on the slide here, but this is actually the University of Alberta Hospital, which is the largest teaching hospital in Western Canada and the home of the FOMD. So within the College of Health Sciences at the University of Alberta, we are home to 20 departments, 8 research groups, and 15 centers and institutes. And the FOMD offers many programs, some of which you may have already attended presentations for, but these include radiation therapy, medical laboratory science, dentistry, dental hygiene, and last but certainly not least, the MD program or medicine. So with that, welcome to medical school. We have 678 exceptional undergrad medical students. Our faculty is composed of more than 700 full-time faculty and 2,200 community faculty. The MD program is a 4-year undergraduate degree, and at the end of the 4 years, students graduate with a Doctor of Medicine. I'd like to add that residency follows the 4 years of school, which is also a required part of training to become a practicing physician. So our program opens up the opportunity for you to become many different types of doctors. This can range anywhere from any of these on this list. So you could be a general family doctor, a radiologist, ophthalmologist, or many different types of surgeons. So this list is not limited to these options, but this opens up the career path to many different types of doctors. Access, community, and belonging is very important to the MD program, and we have many different initiatives and groups within the program that help to make people feel seen and heard in medicine. So today I just wanted to highlight the Indigenous Medical Dental Student Association, as well as the Black Medical Student Association at the University of Alberta. Okay, so the part that you've all been waiting for. Let's talk a little bit about some of the highlights of the admissions process, and then we'll jump into some information about what it's like to actually be in our medical school program. So with this, I'd like to remind you all that the most up-to-date admission information and details can be found on our website, which will be on the very last slide of this presentation. So it's very granular. What's posted there, pretty much anything you could want to know is on our website. So make sure you check that out if you have any questions that aren't able to be answered throughout this presentation. So with that, when applying to medicine, we have academic requirements and we also have non-academic requirements. So medicine is really for everyone, and we accept students that have a variety of different background and experiences. So in the academic requirements column, you'll see that we have a bachelor degree, and we really do say that you can have any bachelor degree as long as it meets the 60 transferable credits of course weight requirement. The subject matter of your bachelor degree does not actually matter when it comes to applying for our program. Any major is fine, any minor is fine, any degree is fine. Under CGPA, you'll see for applicants who are applying as an Albertan resident, we do require that you have a minimum CGPA of 3.3 3. And for out-of-province applicants, you'll notice that we have a minimum requirement of 3.5. So just because you reach these minimum requirements does not guarantee admission, but that gets you on the right track. Next thing you'll see on the academics requirements side is that you will have to write the MCAT exam, also called the Medical College Admissions Test. So basically this test consists of 4 different sections, and for Albertan applicants, you will have to score 124 in each of the 4 sections minimum. For non-Albertan applicants, you additionally will actually have to have a higher score in the CARS section, which would be a minimum of 128. And once you have reached these scores within the MCAT, your score for the MCAT's actually not used competitively beyond that. It just kind of checks the box for that requirement, and then we look at some of the other aspects of your application. And also something to note, your MCAT score is actually valid for 5 years. So you don't have to write the MCAT the year that you're planning to apply. We actually recommend that you try to write the MCAT further in advance, just in case you're not successful on your first attempt. That'll help you not feel like you're in a crunch when it comes to the actual application process. Also, something else that I wanted to note when it comes to picking your bachelor degree, some of you might be in a scenario where you haven't actually decided what you want to explore for your undergrad before you look into our program. We highly recommend that you do some alternate career planning just because our program is quite competitive. And with that bachelor degree that you select for your academic requirement, make sure it's something that you enjoy, that you're really passionate about, and that you would potentially be happy using that in an alternate career path. So just because you think that, science is the way to get into medical school, that is not always the case. Select something that you think you'll do well in, that you'll excel in, and you can get a pretty decent CGPA in. The next thing I'll explore a little bit here is the non-academic requirements. So you will be asked to describe some personal activities, and these include experiences such as employment history, leadership roles, volunteer work you've participated in, life experience and achievements that you're proud of, and finally, you'll get to describe some personal highlights about yourself. So basically, these can be any personal activities that you feel represent something special about yourself in the past 10 years. And I will add that these need to be verifiable. And we do ask for verifiers just to kind of back up what you express in your application about these things. We also do ask for 2 professional references who are in a supervisory or professional role to be able to answer some questions on your behalf. We require an additional online assessment called the Casper test. And finally, for selected students, we do offer an interview. And this interview, in a nutshell, consists of multiple mini interview stations, as well as one larger panel station. For this program year, we are not admitting international students. We do allow only Canadian applicants or permanent residents, and the ratio for the class is typically 85% Albertan residents and 15% out-of-province applicants. Applying to medical school can feel kind of out of reach for multiple reasons. And we do actually have some initiatives that can help you feel like medical school is within your grasp. So to go through a couple of these initiatives, I'll start with MD Aid. So this is a free student-led MCAT and interview prep course. They have their own kind of eligibility requirements, but the goal is to help applicants from underrepresented backgrounds who might not have had the same opportunities to be able to study MCAT material or have interview practice. So if that sounds like it's something that might benefit you, feel free to look into MD Aid. We also have the MCAT Fee Assistance Program. And that is for Canadian examinees who are in financial need and might need, again, some help preparing, studying, and then registering for that MCAT exam. And the final one that I would like to mention here is the medical school application fee waiver program. And that, again, is a financial assistance initiative that actually waives the MD program application fee for anyone who is eligible and selected for that program. Within our program, we do have a couple special admission processes. So one of them, for example, is for Black applicants who voluntarily self-identify on their application, and they have the opportunity to go through the Black applicant admissions process. We're also very committed to the recruitment, retention, and graduation of Indigenous students. So Indigenous applicants also have a special admissions process through the Indigenous Health Initiative, or IHI. There's also an initiative for applicants who are currently serving in the armed forces through the Medical Military Training Program. The last kind of special circumstance for admission that I would like to highlight today is actually our process for rural applicants. And this is actually a really exciting topic for this year because this fall we are welcoming our first stream of students through this new program. So we are actually we reserve 30 spots for qualified rural applicants. And these rural applicants through the NAMP program will be given first choice to study at the brand new Grande Prairie campus, which is located at Northwestern Polytechnic School of Health. And basically, this campus, we're aiming to train graduates to become family and general practice doctors that practice in rural, regional, and Indigenous communities across Alberta. So this is a really cool opportunity, and if you're listening to this, you might be within the few first classes to be able to try out this program, and you receive the exact same accredited program that you would receive at the Edmonton campus. So you would still graduate with your MD degree, but you would actually get the opportunity to do it in a rural setting. With this admission process, there is actually 2 additional non-academic requirements within the process. So with that, you will be required to provide a written statement about kind of your connection to rural communities and why you feel like that fits in with where you would want to be in your future. And also you will be doing a separate rural interview panel in addition to the other interview requirements within the process. So let's jump into a little bit about our combined degree programs and some research opportunities. So on the research side, we actually do offer the MD PhD program, which allows students to gain both their MD degree and their PhD degree to pursue a career as a clinician scientist. So basically, after you've completed your first 2 years in our program, you would actually take a break and complete your PhD, and then you would come back to the med school to complete your 3rd and 4th years. We also have a special designation available called MD STIR, which allows students to get a taste of academic medicine. So once you've been accepted to the MD program and you've also been accepted to the STIR program, you will be asked to complete a minimum of 24 weeks of research under faculty supervision. And once you successfully do this, you actually receive a special designation on your transcript as well as your degree parchment. We also have opportunities for summer students to do research opportunities. These can be anywhere between 2 and 4 months long, and we have usually approximately 200 students participate in this, making this actually the largest program of its kind in Canada. So again, if you're interested in research and you need a summer job, this is actually a really great program for you as well. In terms of combined degree programs, we also have another stream where you can get your medical school degree as well as your master's of business. And you can do that within 5 years of education. So kind of to summarize a little bit about our admissions timeline. So about now, you'll be working on your bachelor's degree, and you're also going to want to start to develop your personal activities for your application. The application opens on July 1st of the year before you want to apply for the program. So kind of after you've started those things, you want to start thinking about writing and preparing for your MCAT exam. Again, planning to write your MCAT earlier just to kind of have that idea in mind that you might need to write it more than once would benefit you because that score is good for 5 years. The last date to write the MCAT is typically in August of the year before you want to apply to the program. So for example, this year, that's going to be August 24th, 2025 would be the last date you can write your MCAT exam to have it ready for the application deadline, which is, as you can see, October 1st. So if you're coming straight out of your bachelor degree and wanting to go right into your MD degree, that application deadline basically hits right at the beginning of the last year of your bachelor program. After that, you're going to want to think about writing the Casper test. Again, the Casper test is one of those things that once you write it, you kind of get your check mark and it is not used competitively from there on in your application. After that, we have the interviews. So selected applicants will be sent notification that they have been offered an interview, and those would typically take place in March. And currently, those interviews are being held virtually, and that just makes them, I guess our idea behind it is it makes it more accessible to people to be able to participate when they don't have to travel for in person. So that is why we're currently doing it virtually. Then come May, that's when the, acceptance letters come out. So if you were successful in your application and your interviews, mid-May is when you would get your letter to begin the MD program the following August that fall. So that's a little bit about the admission process. And with that, I'm actually going to pass the reins over to Jason, who from personal experience can actually tell you a little bit more in depth about what it's like to be in our program.
Awesome. Thank you, Farrell. So yeah, again, my name's Jason. I'm a second year med student. So I'll be talking about kind of what's the med school experience like once you get in. So we can start off with this slide here. This is the White Coat ceremony. So first year medical students, around the fourth week of their first year, we have this large ceremony where you get handed your physician's white coat. You take some photos. I still use this photo. Not this one that you're seeing, but me in a white coat, I still use it for some profile pictures and stuff. So that's kind of a way to welcome the students into medical school. And then we'll go to the next slide. Now, in terms of what the program looks like, so as mentioned before, it's a 4-year program and it's kind of split into 2 parts. So the first part is years 1 and 2, and that is your pre-clerkship. So this is more on terms of classroom-based learning, small group sessions. You can see on the right-hand side, you basically go through the systems one by one. So you start with foundations of medicine, which is basically keeping you up to speed with things like, learning about proteins, learning about basic physiology, and then you go into the body systems, endocrine, cardiovascular, pulmonary, and renal. And then year 2 is similar. You just keep going through the different systems. I'm currently in the musculoskeletal system, so I'm almost through all the systems now. In terms of lecture time, you can expect anywhere between as little as 5 hours per week of lectures, but as much as 20 hours. So it kind of depends on what the topic is and what else is in that week. So again, there's some small group sessions, there's some physical exam, communication sessions. It kind of varies, which I think is actually really nice. You're not just spending all your time in the classroom, of course. So on an average week, you could expect around maybe 10 hours of lecture and a few physical exam and communication sessions as well. Next slide. And so outside of the body systems that you'll be learning about, there's these things called longitudinal themes. So there's these kind of learning objectives that the school is trying to teach you throughout all 4 years. So things like professionalism, communication skills, as I mentioned before, physical exam skills. These are things that they don't teach in a certain block, but they teach through it throughout the entire MD program. And the photo you see here is actually, it's like an art project that second year med students complete. So I will be doing this as well, I think in about 2 or 3 months. So the idea is just to not teach you, very clinical stuff, but also the more, life skills, more of a holistic approach to training doctors. So once you get through years 1 and 2, then it switches to the second half of the program, and we call that clerkship. And this is more practical in the sense that you're going to spend much more time in the hospital and clinic rather than the classroom. And instead of going through blocks through body systems, you'll be going through different specialties. So again, you can see on the slide here, you'll be going through things like family medicine, general surgery, internal medicine, and the like. And that's across 2 years, year 3 and year 4. And I actually just got my track selection options a week ago. And I think each rotation is about 6 weeks long. There are options for electives. I think that's on a later slide, but there are some rotations that everybody goes through, as you can see here. Oh, yes. Okay. So electives. So on top of the mandatory rotations, again, things like family medicine or surgery, there's also room for electives. So these are more specialized, basically options that you can take during third and fourth year. There's also electives in first and second year, but they're a little bit less intensive. But what's really cool is that when you do these electives, it can be at the University of Alberta, but you can also go province-wide, nationwide, and even some international electives. So if you're interested in a certain type of medicine and maybe they're offering that elective in UBC or like in the UK, then you may be able to apply for that and do that elective. And yeah, for first and second years, there are some electives as well. I think I am currently doing a family medicine elective right now, just like looking at the diversity of family medicine. So keep that in mind as well. So student supports. Also, fun fact, if you're seeing all these photos, these are actually my classmates. We did like a photo shoot last year. So it's kind of cool. I'm like seeing all my classmates here. But student supports. So med school it is, I think, the best program at the U of A, but there are times where it's stressful. So the supports are really important. So the Office of Advocacy and Wellbeing, also known as the OAW, I kind of think of them like they always have the students back, right? Like if the student is feeling unwell, if they feel overwhelmed, if they need some extra support, the OAW is always there. They also they offer some lectures and some sessions on mental well-being in first year and I think second year as well. And of course, the Faculty of Medicine and Dentistry, they have a lot of different initiatives throughout the year. So keep your eyes open for that. And in terms of finances, there's a lot of scholarships and bursaries out there, both with the faculty and the U of A and also outside the university as well. So kind of those different aspects help students fund their medical education. And also a lot of banks will try and support us through things like lines of credit. So if or when you get through the 4 years of medical school, you finish med school, so you congrats, you get your little diploma, you graduate with your doctor of medicine. However, as mentioned before, now you start your residency training program. And so I think an earlier slide talked about all the different types of doctors, surgeons, psychiatrists, family doctors. This is when you get that specialized training, and that's called residency. So there are 55 residency programs with the U of A, but of course you can choose a residency across Canada. Yeah, pretty much across Canada. And the choice of your specialty determines the length. So I believe the shortest residency right now is a family medicine residency, and it can go 5 years and beyond. And I think in the next slide, it describes that. Oh, it does not. Oh, wait, it does. Yeah, it does. So this is just like a timeline. I know this was a lot of information that we threw at you. So if you're struggling to find out the timeline, this is basically the overarching thing. So number one, you need to finish high school. So I hope everyone watching either has their high school diploma or is working towards it. You need an undergraduate degree. It doesn't actually have to be 4 years. I actually did mine in 5, and I know some people that took 6. So it doesn't have to be 4 years exactly. Medical school is 4 years typically. I think there are some exceptions if you do like a MD MBA or an MD PhD joint programs, but it's typically 4 years. And then I just mentioned residency, again, 2 to 5 plus years. So again, it depends on the specialty that you choose. That'll dictate how long your residency is. And there is also something called a fellowship, which I believe is even additional training past residency. And that can be another 1 or 2 years. And then after all that, at the end goal, you become a practicing physician. So it's a lot. Um, so I put this slide here. I didn't know what to put. It was a lot of pressure. I wasn't sure what picture to put to describe my journey to medical school. I don't know if anyone knows who this is, but if you do, that's really cool. That's me with a YouTuber named Teddy Baltasar. So he is a watch channel. So he reviews wristwatches like Seiko, Rolex, Omega. And I went to a conference in New York in 2022. And basically, I think that kind of describes my journey to medical school. I basically graduated from the U of A in 2021. And I wasn't sure what to do. And it was also COVID, so a lot of things were shut down. I was meaning to teach abroad in Korea, but then COVID hit, so I couldn't do that. So I ended up traveling a lot. So like I went to New York. I started a YouTube channel called A Channel About Watches. If you'd like to subscribe, I also do wristwatch reviews. So I did that. That was kind of and it still is like one of my passions. And I also worked at the library as a library assistant. And so really like, honestly, I didn't really come in with a plan once I finished my undergrad, which looking back, I don't recommend you doing. Like I recommend everyone have a plan when you finish your undergrad because it took me 3 tries to get into medical school and I didn't really expect that at first. So I wasn't really sure what to do. But thankfully, I found a job. I explored my passions. I applied to the School of Public Health as a backup, and I applied for an education after degree as a backup. So I think those 3 things were the things I focused on my journey to medical school is like personal endeavors, um, future planning, and I guess getting a job as well. That was also something I had to do. Um, so yeah, I think that's oh yeah, and applying 3 times. I think that's pretty much culminates or summarizes my journey to medical school. I think Julia just came in. So I believe she is a 4th year student. And yeah, she's here. So she can also chime in with her journey to medical school.
Hey everyone. My name is Julia. I'm in my 4th year, like Jason mentioned. So I actually was just coming from one of my residency interviews. So right now we have 3 weeks off to just interview for our residency of choice. So I'm applying internal medicine. So that's what I was interviewing for this evening. So my journey was a little bit different. And the reason I put this picture of me and my partner in is because my partner is actually already done his training. He's a pediatric cardiologist. We're the same age, but I took what you would call the scenic route through medicine. So before med school, I actually had a career for about 10 years. I worked as an infectious disease pharmacist. So what that entailed was I did a bit of undergraduate science. Then I got into pharmacy school, did my 4 years of pharmacy school, did my residency through U of T, and then did my master's through Queen's. And then I worked as an infectious disease and antimicrobial stewardship pharmacist. And during COVID, my role kind of changed and I became more interested in pursuing medicine. And it's at that point that I decided to kind of apply to U of A and I got in. I was lucky. but everyone kind of has a different route. So my partner here, where we come from in Quebec, you can actually get in at the age of basically 18 to medical school. So that's what he did. He took a very different journey. And for him, his pathway worked out. He's very happy with his career. He did a 9-year residency, which I would never do, but he's happy with. And so he's happy. And for me, I'm very grateful to have had my first career. When I was kind of first deciding what I wanted to be when I was 16, 17, applying to university, I didn't really know. I didn't have any doctors in my family. Most of my family was either kind of mechanics or blue collar workers, like more tradespeople. Not many healthcare workers in my family. And so I guess being a pharmacist kind of felt interesting, engaging, attainable. I liked that it had job security because I wasn't somebody who could kind of afford to live off of my family, which is probably the position that a lot of you are in as well. And so for me, I was very happy with my pharmacy career. And if anyone wants to kind of talk about the pathway to get into pharmacy as well, I'm happy to talk about that. But ultimately, I landed on medicine after a long career in healthcare. And what I've enjoyed about medicine is there's a lot of flexibility in medicine. The chance to subspecialize kind of more formally is really nice. I do like being very involved with the whole team. And I like that we get to play a leadership role in the healthcare system. So for me, I'm happy with the transition to medical school, even though by the end of kind of all my training, if I do internal medicine, I'll have done 17 years of university. I try not to think about it, but I'm happy with my journey. And so I think that if medicine is something you're interested in, even if it feels unattainable, you should go for it. You should seek out mentors who can help you out along the way, because it's not unattainable. You don't necessarily have to wait and do a full 12-year whatever first, like me. And I also think there's a lot of different ways to find happiness. There's a lot of different ways to get where you want to be, and it's okay to not have the answers right now.
So with that, that concludes our presentation. So at this point, just take note of the website. Again, if there was anything that we didn't touch on today or you have unanswered questions, the website has a very huge wealth of information. So make sure you check it out. And additional questions can also be sent straight to our admission experts at mdadmission@ualberta.ca. So with that, I guess we'll open the floor to some questions.
There's a couple in the Q&A already. I can just read them off if you want, as you want to answer them, if that works. Yeah? Okay.
Yeah, that sounds good.
Perfect. So the first one in here is, are there any special admission processes for disabled students?
So currently there are not any special admission processes. However, we do encourage you to apply as long as you meet those eligibility, what's the word I'm looking for? The criteria to be able to apply. And we actually do have accommodations within our program, depending kind of, where you're at, what you need in order to achieve your education. So again, we just really encourage you to apply, and we'll work with you to make sure that you're able to learn in the best way possible.
And then the next one, are you able to provide any more information on the Casper test? Is it more of an aptitude test or a test for fit in the profession?
I actually might pass this one along to Julia or Jason, as they have actually written the Casper test in the past.
I've done it twice. Actually, I had to do it again to apply to residency. The Casper test it's called a situational judgment test. So basically what it's designed to do, it kind of presents you with what would be considered a gray area situation, whether it's ethical, whether it's kind of normal judgment, and it kind of gauges how you respond to that situation. So back when I did it the first time, when I got it the first time, it used to just be you type answers, like they'd give you kind of a stem. You think of how you would react in that situation, you type your answers. Now there's two portions. There's a video portion where you actually speak and record yourself answering. And those questions are fast. It's like 10 seconds to think about what you want to say, and then 60 seconds to answer. And then there's the kind of the written portion, which is you get the stem, you have 5 minutes to answer a series of about 3 questions on the same stem. So I don't know if Jason, you have anything to add, but that's kind of how I view it. It's actually kind of fun. It's like, Casper's not stressful. The MCAT takes work to study for, to be honest. Like the MCAT took me a good 8 to 10 weeks to study for, but Casper is kind of chill.
Yeah, I can add on to that. So yeah, like as Julia said, it's an online test. Yeah, and I can agree that like the preparation is a lot less. Like it's meant to like get a snapshot of like your kind of ethical decision making, your problem solving skills. Um, like I studied the first time I wrote it, and then every subsequent time I just wrote it after. Because really like you can practice maybe like once or twice before you write it, but it's definitely not a thing where you need to spend 8 to 10 weeks like going through it. Once you're familiar with the format, that's probably like what you can do. And maybe if you have really slow typing speed, I would maybe work on that. I had really bad typing speed. And of course it's about quality, not just quantity, but of course if you're writing like 5 words, then your quality probably can't be the best it can be.
Okay, next one. Does doing an undergrad at the U of A increase your chances of getting into the med school? Are more applicants from the U of A admitted than from other schools?
As for application data, I don't think that's actually something that we currently track or have posted, but we do have application data available on our website. In terms of if a U of A specific undergrad gets you a preference, the answer is actually no. So as long as you have an undergrad degree that has the required amount of transferable credits and course weight, that actually meets that requirement. So no, if you have an undergrad degree at other schools, still apply. You're just as likely to get in.
Adding on to that 60 credit course weight, there's a question about that, that it is one of the academic requirements that applicants must have. But can you elaborate on what that actually means or what that looks like?
So it kind of depends on your circumstance and what your undergrad degree is. We within the program don't do any kind of transcript evaluations prior to applying to the MD program. And that's something that actually happens centrally at the office of the registrar. And that's where they decide if your previous degree has the amount of course weight required for admission into our program. Does that answer the question?
I think that does. I will say most Canadian bachelor's degrees will fit that criteria, in terms of like recruitment things and admission stuff that we look at. Okay, a good experiential question maybe for Jason and Julia. Are students allowed, or do you think it would be a good idea to have a full-time job while in the MD program?
I can add on to that. I don't think there's anyone in my class that's working full time. I know a few people that are working part time. Like one of my friends is a pharmacist, so he works as a pharmacist on weekends, but he's been telling me like once he hits clerkship, so third year, like he's probably going to renounce his pharmacist license because he just can't keep it up. Yeah, I think most people would work like a 0.4 or less. Probably on average, the average person doesn't work during medical school just because it's a really big time commitment. So we want to put our best effort in that.
Clerkship, like Jason said, it's really almost like I still work as a pharmacist in clerkship. But I work maybe during third year, I work maybe once a month. Now in fourth year, when we have elective time, I work maybe 2 shifts a week, but it's because I'm otherwise off, just doing interviews or on electives. But most people during third year, like third year, there are rotations where 1 out of every 4 days, you're working a 26-hour shift. So you actually mathematically wouldn't be able to work.
Yeah, med school is a big commitment for sure. I have a friend who's in her second year and it's it seems like a lot right now. Okay. This is a good one, to clarify the breadth of undergrad degrees. Are there any undergraduate degrees at the University of Alberta specifically that would not qualify for admission?
No. So any undergrad degree, again, that meets that transferable course weight criteria is actually eligible for admission.
Okay, this is a good one. Are there any extracurricular activities or roles of employment that are beneficial or sought after for admissions?
So From an admissions perspective, we don't give preference. As long as again, it's something that you're passionate about, you're willing to dedicate the time to, you have verifiable hours for those activities. We don't have preference in terms of what exactly it is you do. I think it's more, we want to see who you are as a person. We want to see you pursue your passions and also that you're willing to give the time to do those activities. So maybe even Jason and Julia, maybe they could share a couple that maybe you put on your application.
Yeah, I can share one. I think one general advice I would give, especially to people who are younger in applying, is I would I would encourage you to have at least one, how do I put this, like a real life experience. And what I mean by that is I know some friends who they're very smart, like smarter than me, um, very involved academically, but I think there's value in just going out into the real world, whether that's working, even like working retail or at a restaurant, or if you're working just with people, like everyday people. Because of medicine, you're also working with everyday people. Like your patients will come from a variety of backgrounds. And I think that's one thing I noticed. Like in school, you're in some ways kind of sheltered. Like you're surrounded by people roughly the same age as you, roughly the same career ambitions and backgrounds as you. So yeah, that would be one thing to consider. And that's not like a specifically like, oh, go work at McDonald's, but just work somewhere or volunteer somewhere where you get to see people, just like everyday people in real life.
So I obviously, kind of having had a career, had a different background than a lot of people when I was kind of filling in my extracurriculars. So I probably had a few things that had helped me out and that I'd done some unique things as part of my previous role. So as part of my previous role, once the COVID vaccines went live in Canada and there started to be reported hypersensitivity reactions, it was myself and an allergist who were running the clinics evaluating patients. We did research on that. We also contributed to the international guideline on COVID vaccine allergies. So for sure, those were things that helped me stand out. But I think really what, like I also ski, I put things like skiing and hockey, things that really mattered to me that might not seem kind of big or important, but they do kind of give people a sense that one, you're not a purely academic person. You're somebody who can relate to other people. You're a decent person who has normal interests and you'll be able to talk to people because that's a lot of medicine. But two, I think at the end of the day, people can tell if something you were if something on your extracurriculars is what you were genuinely interested in, or if it's something you just did to meet a checkbox. And if you just did something to meet a checkbox, you're never going to look as good as if it was something you really cared about. So if you're passionate about something, you're more likely to take it further. You're more likely to do better at it. You're more likely to write well about it. So non-traditional applicants, like people who had previous careers, we probably have a bit of an advantage for filling out the application just because it's probably in some ways easier to stand out. But at the same time, if you do what's interesting to you and you've excelled in something that seems totally not academic, it's still important. And my classmates, when I look around, we're all very different in where we came from, but we're all interesting and unique in our own ways. And I think that also people reading applications want to see kind of unique things. They want an overall balanced class. So like Farrell said, and like Jason said, if you are just writing about what makes you you and things you really care about, you're likely to kind of stand out.
Okay, another couple kind of tied together questions. If you know the answer to these, how many students are accepted into the MD program each year? And then typically, how many applications do you receive each year for the program?
So I will say that we have been increasing our numbers over the past few years, and our current upcoming application cycle will be 192 students in our class. In terms of the amount of applications we get lots. So kind of the ballpark number we share is that 1 in 10 students will be successful in getting into med school.
Perfect. Okay, this is another good question. If you study medicine in Canada, can you apply to do your residency in another country like UK or USA?
Yes, you can. Yeah. Maybe Julia knows more about that. I've been involved slightly with the Canadian process and a little bit with the US residency match process, but beyond that, I'm not fully aware of the opportunities.
Yeah, you can apply to other residencies for sure. I don't know the process for the UK because people don't tend to go to the UK as much. The US, though, for certain competitive specialties, people certainly will apply. The process for the UK or the US, you have to kind of decide early on because there's a series of licensing exams for the US that you have to have taken to be able to apply to residency in the US. So people in my class who are applying to, say, plastic surgery, which is really competitive, they'll figure that out early and they have to do those series of licensing exams. So if you're somebody who's like, maybe I want to go to the US, you have to kind of look early into when you want to do the different licensing exams. Because you do have to, first of all, you have to score reasonably well because some programs in the States do look at how you scored on their licensing exam as part of their process for review. But secondly, you actually have to have taken, I think it's 3 exams before you can apply to residency in the States. That said, the way residency process works is, so like me, I have 17 interviews for residency. And I'll interview at all these programs and I'll rank them 1 through 17 in order of my preference. They'll also rank all of their applicants in order of their preference. But on match day, you get 1 match. So you don't get job offers, you get a match, and that's a binding contract. And if you're participating in the Canadian match and the American match, you can only match to 1. So if the American match happens to have their kind of match first that year, like this year, they're matching before the Canadian match. If you match in the States, you will not match in Canada. You have to declare in your Canadian application that you've applied to the American match. They'll talk to them. And if you've matched the States, you won't match to Canada. So there is kind of some decision making around it because you can't necessarily have both. And so you have to actually decide which one you want to go with once you're in 4th year.
Okay, next kind of general area of questions that we're getting is if you have a master's or a PhD, does the application process look slightly differently? How does the admission process work? Do you have a better chance of getting in with that? All of those kinds of questions.
So to be brief kind of on that, yes, there's lots of details on our website in terms of applying with a master's or a PhD, but the general point is that you do actually get some extra points on your application if you have completed a master's or a PhD prior to entering our program.
The next question that I'm seeing, which is pretty good, are there any courses in an undergrad, if you're planning to take something other than science, maybe that would be beneficial in preparing for the MCAT exam?
I mean, that's a great question, and I don't know of any in particular. Obviously, having some experience with science will help you write that test, but also you can buy study guides that give you all that information as well, and you can study that. And as long as you have scientific aptitude, you would be able to pass the MCAT and be successful in medicine. So maybe if Julia or Jason took something specific that they found helpful, but overall, you can just buy the study guides and actually prepare that way as well.
Yeah, to answer that question, like I would say like the 100, 200 level sciences, it does help because those types of questions or that type of knowledge would be needed to write the MCAT. But as Farrell mentioned, like you can use the prep books. So to answer that question, like yes, you can take courses, like just throwing it out there. Like if you take the introductory physiology, biochemistry, you take introductory psychology, introductory physics, like it would technically help. But if that means like you're gonna get like a C in that, like let's say you're a math student, I wouldn't encourage you to take psychology and potentially like maybe get a C because you're not as well versed in psychology. You can learn it from like a prep book instead. And yeah, when you prep for the MCAT, just keep in mind how much background information you have. If you're a science background with like 100, 200 level courses, it might take you like 2 months. If you've never taken like any science courses at all, it might take you maybe like 4 months, but you certainly don't have to take the courses in U of A to write the MCAT.
I definitely agree with Jason. Like, I think having done a strong science degree definitely really helps because for me, I'd been out of basic sciences for 12 years or something, maybe not 12, maybe 10 years by the time I wrote the MCAT. And even so, learning from recall, having already learned it in depth once, is so much easier than learning it from scratch. Like, I'd taken a bunch of physics. I took physics 1 and physics 2 before pharmacy. I had to take phys chem in pharmacy as part of my degree because I'd only done 1 year of undergrad. And that coursework for sure helped me. I think the MCAT is much more challenging if you haven't done a science degree. That said, if you're from in province Alberta, the cutoffs now for MCAT are very low, whereas GPA requirements are high. So like Jason said, if you're choosing, do you want to sync your GPA to kind of get more background for the MCAT? Like Jason said, I wouldn't take that route for sure. Especially if you're in province, because the cutoffs for MCAT now are so low comparatively speaking. And I think someone else asked me how I prepped for the MCAT. I just used the Princeton books. I bought them off Craigslist for like $50 from somebody because they're like $400 new. So I used those books, and the Princeton books were great. I don't know, Jason, if you used something different.
Yeah, my friend let me borrow his Princeton review, and I still have them. I forgot to give them back.
Okay, let's do a couple more since we have about 5 minutes left. Jason, specifically for you, what bachelor degree did you take prior to med school, and would you recommend or deter from it if given the chance again?
So I studied science, general science. I think it's okay if I say this. From my opinion, okay, I'll say it like this, like I'm 26, and a lot of people in my age, actually maybe even beyond, a lot of my friends just went to university without a plan. I think I mentioned this before. Like, we just took a major and just rolled with it without any idea of like what to do next. So I did that exact same thing. Like, it wasn't until fourth year when I was like, wow, I didn't even declare a major until fourth year. I didn't even know what I was doing. And it wasn't until fourth year did I start to plan it. Looking back, would I have done a bio degree? Probably not. I probably would have focused on something more. I actually might have switched to business now that I think about it. So I guess that's kind of the answer I can give is I guess I would have changed it because I would have been more focused. Because what I'm finding right now is a lot of my friends finished their undergrad and then was like, okay, I don't know what to do now because I just, my friends went to U of A. I guess I'll go to U of A too, but they didn't really think about what can this degree get me? What's the next step?
I will say from personal experience, I did the same thing. I'm not in med school. I'm not planning to go to med school, but as my undergrad in biology with a minor in psych, I did the exact same thing out of high school. So somebody had a question here on like changing your degree partway through. Do it. If it's going to be more interesting to you to change what you're studying, I feel like that's only going to help your med school application in the long run.
University is expensive. So
Yes.
I just think like, oh, I'll just finish us 3 more years, I'll finish it. It's like that's a lot of time and a lot of money. So be intentional with what you're doing.
Yes, I discovered physiology was my passion in my fourth year, so I did not change, but I took a lot more classes in that. Okay, this is, I think, going to be the one last question that we do. And I will just say that there will be a recording of this session that we will most likely post online. It won't be posted in the next couple weeks, but look out for it after that. And then one here, are there any reasons that someone would not straight out would not be accepted into med school? Any major factors that could cause people to be rejected other than like not being good enough for the GPA or things like that?
I would say one thing that comes to mind with that question would be if you have a criminal record. You do have to have a clear criminal record in order to be successful in entering our program. Aside from that, it would just generally be, well, even if it's not a criminal record, if your references are saying there's been things with professionalism, any kind of professionalism flags will definitely exclude you from the pool to be able to get into our program. And those are kind of the major ones that come to mind, aside from not being a resident of Canada or Alberta. And yeah, again, just kind of those other eligibility pieces, not meeting those requirements. Those are kind of the big red flags that would exclude you.
Perfect. Well, we got to 6 o'clock. This was an amazing session. Thank you for everybody who attended. Thank you for all of our panelists for sharing all of your experiences. It was great to hear the personal experiences from 2 different points and 2 different journeys to med school. So that was really cool. If you have more questions, please use that email. Please check out the website. The quick short link is uab.ca/md. And then you can find all of this information on there and send any other inquiries to the email that you may have about your specific situation and things like that. But thank you again, everybody, for joining us. And I hope everybody has a wonderful evening. Bye.